happened with the live. I have a great signal where I am. But the live was disconnected. And I just text Dr. Shiloh and I asked him if he can continue his conversation because he was really giving us informative information on mental health. And he talked about the patients he deals with, and he has this form he has them fill out, asking personal questions, how you deal with life every day. And it's very significant, the change from when they are dealing with fibroids versus when he removes them. So he has them fill out this form. 3 to 6 months later, they fill out the same form, and it's a difference in what they're saying, because when he removes the fibroids, clearly that's changing their lives dramatically, because it changed mine. But let's see if we can get Dr. Shiloh back on. Hopefully there's no interruptions this time. Let's see here. Dr. Shiloh, can you send a request? I would love for you. There you are. Let's go live.
I'm back. I think I'm back. There we are.
You're back. I don't know what happened. We were having a good conversation, but I'm going to post both videos because I want people to hear everything you had to say. But can you just kind of go over and tap into what you were saying when it pertains to mental health and fibroids? Can you go over that?
Sure. I mean, as I was saying, there's you can talk a lot about data and science and so forth. But the truth is that what I see is day to day how dramatically, fibroids affect women's lives, and unfortunately not in a great way. And for some reason, the medical community in general is not as attuned to this as they should be. So I should say to you, Shay, as I have in the past, that what you're doing for women and as far as bringing this to light and bringing this conversation forward is really amazing. I mean, almost every day I have women. I know I've told you this before, but every day I hear women who say they saw you and come to us through their Instagram, and so it's really very impactful. What we need is more people like yourself speaking about this, because unfortunately, as you and I have discussed, fibroid disease affects 50% or more of Black and African American women. So that is a large number of women. And there are 400,000 hysterectomies done every year in this country. That's a lot of uteruses that are being removed unnecessarily.
Unnecessarily, exactly, because I was one of the ones that had I had a myomectomy. I didn't have my uterus done. I didn't have a hysterectomy, but I could have had a UFE, and it wasn't an option for me. But right. During my fibroid process, I needed mental health. I think that should be a part of the removal of fibroids, is having someone there to talk to you about the life experiences you've been going through while you have fibroids, to let them know it's okay. You don't have to suffer in silence. You're not the only one who's felt depressed, who felt like they needed to pull back from family and friends, and because that's what I did. I literally just became enclosed and didn't talk to anybody. So that's why I wanted today to focus on mental health, because I went through that process and I didn't even know that mentally I was destroying myself and I was depressed. I just knew I ran. That I just ran away from everybody and everything because I was so embarrassed.
Right. And I hear this story so often, Shay, that it is, a lot of stories about women who don't want to leave the house for days during their period. They're going to soil their clothes. They have to always know where there's a bathroom nearby, because they could have a problem, and they need to be constantly ready. And, we have to understand that it really dramatically affects people, and then becoming shut in because you don't want to talk about it, you're embarrassed or whatever. And again, having these conversations and allowing other people to know that they're not alone, and they have resources, and there's definitely people like myself and other doctors in the company who are really willing to listen and to help. I spend probably most of the consultation when I speak to people, I'm talking to them about what type of symptoms they have, how that's affecting them. Of course, we discuss what treatment options they have, but really just to get to the bottom of what's going on with them. And you can't tell you how many times women just, they pour their hearts out because they've wanted to talk about this with somebody, and they just haven't had anyone who's been willing to listen And that's what we need to be able to do, is just listen, hear the problem, and hopefully find a good solution for them. And I think we have that. And again, it's really a testament to you and your tenacity that you're bringing these conversations to light on a regular basis, which is really, even if it's just helping one person every day, that adds up. And then that one person and then more people are coming together and discussing this. So it really is a beneficial thing to everybody, Shay. So, I mean, I know I appreciate it. I hope others do as well. And I know there's lots of women out there who have specifically mentioned you to me that have thanked and said, when you get a chance, please thank Shay for helping get to you and getting myself treated.
When I've spoken to so many different people and I've heard stories about how fibroids have broken up marriages, relationships. Mm-hmm. And I think why that happens is because they don't talk about it. It's not like men go through this process. They're basically unaware of what we go through, and they don't have a full understanding of fibroids. So they rather run from the situation. So it's causing arguments and disagreements and, lack of sex in your relationship. So I get why it would break up a marriage. I understand why it would break up a relationship. But I think that if we take control of the mental health process and guide them through this process of fibroids, we can prevent some of that. Because it's horrible to think that fibroids played a part in a divorce.
Right.
That it's really sad. And it didn't have to. It's just because we're not talking enough about it. Right. The
questions we ask in our questionnaire is, how is this affecting your relationship? And again, I mean, how much does it affect your sex drive, your ability to enjoy that with your significant other? And it is amazing to see that it is really dramatically affecting them. And I do try to bring the husband or boyfriend, whoever's with them to the conversation, to try to enlighten them and let them know that their partner, don't forget, a lot of the women are also anemic, so if you're bleeding and your hemoglobin is low, you don't feel great, you have less energy, you're fatigued, and now that's a chronic problem. And then that's why I tell them, listen, when your hemoglobin goes back up to normal after we treat you, you're going to feel like $1 million, like someone just gave you a shot, because you've been running low on gas for a long time. And so that's also a chronic problem, just being chronically anemic and just feeling tired, and that affects you just every which way. And then someone doesn't understand why you're feeling that way, because to look at you, you would say, oh, you look fine. Well, what do you mean? And meanwhile, you're not fine. And so it is a very important issue. Mental health, especially as it involves with fibroids, is important. No one can really see inside your brain and know that you're suffering. And we do, and it's really critical to treat this problem and get it done as soon as possible, so women don't have to suffer in silence.
Yeah, I have one more question. How many women have you seen fibroids affect as far as miscarriages? Because I know it causes miscarriages, and there's a certain person I know that's been trying to conceive for years with her husband, who she's been with for years, and until this day they haven't had a child because of fibroids.
It's a tremendous problem, Shay. That's actually maybe one of the most frequent issues that I've been addressing lately is infertility and fibroid disease. Fibroids cause a tremendous number of miscarriages. Obviously infertility and miscarriages it's hard to always know the exact root cause, but fibroids are a well-established cause of miscarriages and long-term infertility. And, there was a nice study that came out 2-3 years ago out of Europe, Portugal. They looked at 359 women who had never had children, never been able to conceive, and they followed them after 10 years of doing fibroid embolizations on this number of women. And they found that in their 10-year interval, that 40%, so 4 out of 10 of those women were then subsequently able to conceive after having a fibroid embolization. The current guidelines in the United States do not advocate for this procedure for women who have fibroids, but there may be many reasons for that are not clear, but the data suggests...
Why wasn't I offered UFE? Why was I only offered myomectomy and hysterectomy? Why didn't they give me that option to have a UFE, which is a non-surgical procedure, which costs less than a myomectomy and hysterectomy? Maybe that is the reason, Dr. Shiloh, the money. It costs more to slice you open, remove your uterus, or...
I'm glad you said it and not me. So you know, there are
I surely did.
there are
I
definitely
surely did.
interest in determining what treatment plan you have. And, as Dr. Yan likes to say, when you go to Target, they're not going to sell you something that they sell at Walmart or, and it's a shame because, medicine should be a food court, but in fact, it's not. It's, you're going to one person who's offering you what they offer. I'm not disputing that myomectomy has a role in fibroid disease. It does. But when you have numerous fibroids, 5, 10, 15, 20 fibroids, which I see sometimes, a myomectomy is probably not going to cure you. So, we need to be more collegial. There needs to be a better understanding between ourselves and our gynecology colleagues and be able to offer this treatment, the best treatment, not just the one that you happen to have in your pocket. And, without calling different people out individually, there are going to be some competing interests in this. And, it would be nice if that wasn't the case. It's a shame that it is, but us just speaking on this and having more people watching and listening is going to hopefully, even help one or two people, and those one or two people talk to another one or two people, and over time, get our word out there to lots of people.
Last question: what is the biggest size fibroid you've seen in a woman? Mine was about almost the size of 2 grapefruits. And my smallest was about maybe this size. I had 4.
Yeah. So those are large. The one you're describing is large. I mean, that is pretty big. I've taken care of women whose uteruses are up to 25 centimeters, which is, well above their belly button. That's about a 5-month pregnancy. So,
oh my God.
Pregnant, your uterus is about 25 centimeters in size. So you can imagine what that would be like for a woman who's not pregnant to have a uterus up to her belly button. And then they can have fibroids of all kinds of various sizes, some really big ones like grapefruits or even a double grapefruit as you're describing. So, those are pretty large. And we can treat typically up to 25 centimeters. Above that, and when it starts to really get much larger, then we have to think about other options. So sometimes we can treat the fibroids first, and then they can be surgically removed after. But those are pretty big. What you're describing is fairly large, but that doesn't mean it's not treatable. And, every case is different and individualized, and we have to look at their imaging, their ultrasound or MRI, and then determine if UFE is an option or something else is. But for most women, fibroid embolization is an option before they go and have a major operation. For almost everyone.
For a fibroid that big, can you still have a UFE?
Yeah, of course. Yep, absolutely. Yep, 100%. I do it all the time. Every day we see for women with fibroids of that size. So yes, you can have it for that size. The fibroids may shrink a little bit in a variable way. Some of the larger ones don't shrink as much as the smaller ones, but you can absolutely treat larger fibroids.
Okay. Well, Dr. Shiloh, thank you for talking to me. It's been a great conversation per usual on mental health. I think that this was very informative because a lot of women, they struggle mentally with how to deal with this because they're in relationships or because they don't want to feel embarrassed. And like you said, you never know when an accident can happen. We have many different sizes of fibroids, and a lot of women don't know where to turn to. Before you get off questions, and also mental health is very important. So I appreciate you, Dr. Shiloh, for talking about mental health, talking about fibroids, and just educating us on what you deal with your patients. So I love you to death. Thank you for talking to me live, and we'll talk soon, okay?
All right, thanks, Shay. You enjoy the warm weather. We're going to suffer up here in the snow.
Yeah, that's right. 77 degrees.
Lucky you. Lucky you. All right. Okay.
Bye.